Hi, I'm Jane, an Alto Pharmacist specializing in fertility. I'm here to walk through injecting your fertility medications. We'll go through several steps together, so stay tuned. Always make sure your hands are washed and you're working on a clean, flat surface. Let's begin. The box of Novarel, sometimes referred to as HCG, comes with a vial of powder containing 5,000 units of Novarel and a 10 milliliter vial of bacteriostatic water for mixing. For this injection, you will need at least one vial of 5,000 units of Novarel powder, depending on your dose, one vial of 10 milliliter bacteriostatic water, a 3 milliliter syringe, a 1.5-inch mixing needle, an injection needle, a few alcohol pads, a sharps container, and sterile gauze or tissue is optional. Before we get started, there are a couple of things I wanted to review with you. Examine your medication. Make sure the medication is not expired. Check to ensure there's no cracks on the vials and there's powder in the powdered vial. Make sure the bacteriostatic water is clear and does not contain any particles. If you see anything, call your provider or an Alto pharmacist for next steps. To begin, flip off the caps on the vial of Novarel powder and the vial of bacteriostatic water and wipe the tops with an alcohol pad. Unwrap your syringe and mixing needle and attach the needle to the syringe and pull off the needle cap. If your needle and syringe come already attached, you may skip this step. Pull back the plunger to draw air into the syringe. Fill the syringe with roughly the same amount of air as the amount of bacteriostatic water you were instructed to mix with. This is usually 1 milliliter or 1 cc. Place the vial of bacteriostatic water on a hard, flat surface and insert the needle straight through the center of the rubber stopper. Slowly press on the plunger to push the air in the syringe into the vial. This step will make it easier to draw up the solution because the vials are pressurized. Invert the vial and pull back the plunger to withdraw the amount of bacteriostatic water you were instructed to mix with. You will not need all of the solution in the vial. When you're done, flip the vial back and remove the syringe from the vial. Place the vial of Novarel powder on a hard, flat surface and insert the needle straight through the center of the rubber stopper. Slowly inject the solution into the vial of powder. Without removing the needle, gently swirl the vial until all of the powder is dissolved. Do not shake. Novarel powder usually dissolves fairly easily. Without removing the needle, invert the vial and slowly pull back the plunger to withdraw the entire contents of the vial into the syringe. The amount of liquid inside the vial is fairly little, so you'll have to slowly pull the needle out of the vial as you withdraw the solution to ensure the tip of the needle is submerged in the solution. Once you've withdrawn all of the liquid, remove the syringe from the vial. Depending on your dose, your provider may instruct you to mix another vial of Novarel powder with this solution. Otherwise, recap the needle, twist it off, and discard it into the sharps container. Now, attach the shorter injection needle to the syringe and pull off the cap. To remove any air bubbles, tap on the side of the syringe so the bubble moves to the top. Gently push on the plunger until you see a tiny droplet come out of the tip of the needle. Once you see the droplet, you are ready for your subcutaneous injection. Today, I'll be showing you how to inject in the abdomen because it's the most common location for subcutaneous injection. However, you should check with your doctor or nurse before injecting to ensure you're injecting at the prescribed location. You should inject at or below the level of the belly button, roughly 1 to 2 inches away from the navel. Try not to inject directly below the navel because that area is very vascular and can lead to bleeding and bruising. You should also rotate your injection sites to decrease discomfort. To prepare for your injection, clean the injection site with an alcohol pad and allow the area to air dry. Gently grasp a 2-inch fold of skin between your thumb and index finger at the injection site with your non-dominant hand. Hold the syringe in your dominant hand like a dart and insert the entire length of the needle into the pinch skin at a 90-degree angle. You can insert the needle at a 45-degree angle if you have less fat on your body. Move your index finger over to push down on the plunger in a slow and steady motion until all of the medication is injected. When you're done, release the pinch skin, hold it for a few seconds, and gently withdraw the needle. Lastly, apply light pressure to the injection site with gauze or tissue if there's any discharge. Discard the used needle and syringe into the sharps container. There may be minor bleeding, bruising, or redness around the injection site. You might also see a drop of liquid come out of the injection site after you pull the needle out. All of this is common and should not be of any concern. Let's talk about storage. Before mixing, Novarel can be stored at room temperature until the expiration date. Once the powder has been mixed, it must be stored in the refrigerator and expires within 30 days of mixing. You're done. Thank you so much for watching. If you have any questions, visit alto.com to get in touch with an Alto pharmacist.